Are you aware that your liver processes every drug and supplement you consume, and liver injury, known as drug-induced liver injury, can develop immediately or within 90 days after taking these products? This is because the liver's function is to remove toxins and chemical waste from our system, unlike the kidneys, which can often be supported by hemodialysis in cases of sudden failure. When the liver stops working properly, there's no equivalent machine to take over its functions. In the United States, there are over 2,000 instances of sudden liver failure each year, and medications or supplements are the reason behind half of these cases. While many drugs can damage the liver, there are 10 in particular that pose a significant risk. Hence, it's essential to identify and limit the use of these drugs. In this video, I'm going to introduce you to these 10 drugs that are most damaging to the liver and describe the initial symptoms of liver damage from drugs. Primarily, your liver serves the vital role of detoxifying your system. It filters everything ingested, from breaking down alcohol, drugs, and medications to neutralizing pesticides in our foods or various chemicals we unknowingly encounter. It processes all these unwanted elements and disposes of the toxins through bile and urine. Due to this cleansing role, certain agents can pose a significant risk to liver health. What should you look out for regarding liver damage signs due to drugs or supplements? Possible early symptoms include abdominal discomfort, elevated body temperature, loose stools, feeling nauseous and the urge to vomit, urine of a dark hue, pale feces or a colic feces, a yellowish tint to the skin or jaundice, which may extend to the whites of the eyes, giving them a yellow appearance, pronounced tiredness or sleepiness, persistent itching and irritation of the skin. The time frame for a medication to impact the liver varies among individuals and is influenced by each person's drug sensitivity. Contributing factors encompass the dosage administered, your current age, concurrent use of liver-damaging agents, or pre-existing liver conditions like ongoing hepatitis, fibrosis, cirrhosis, or a past of heavy drinking. Typically, liver damage symptoms from medications manifest within 5 days to 3 months following treatment commencement. While my primary focus is on prescription drugs, we must not overlook the significant harm alcohol inflicts on the liver, accounting for around 10% of liver transplant cases. Similarly, illicit substances like cocaine can severely impair liver function. However, a crucial note: if your healthcare provider has prescribed any of the medicines I'm about to discuss, do not abruptly discontinue them. Many drugs are vital for managing specific health issues, and, when prescribed by a knowledgeable doctor familiar with your medical history, they can be used safely. Now, which are the 10 leading medications that wreak havoc on your liver? Pay special attention to the final one, as it is particularly noteworthy. Coming in at number 10, diclofenac is recognized among non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen, which may occasionally lead to liver complications. Yet diclofenac is particularly notorious for its higher likelihood of inducing liver damage, with issues potentially emerging weeks to months following initiation. Hence, it's vital to recognize that diclofenac can impact not just the kidneys but the liver as well. Moving to the 9th spot, the drug duo amoxicillin and clavulanic acid, commonly combined in medications, effectively treats various infections, from sinusitis and tonsillitis to pneumonia and urinary tract infections. Despite its beneficial properties, this antibiotic blend has been implicated in numerous instances of severe liver damage. Sudden liver damage, known as acute liver injury, is a critical health issue that can lead to severe repercussions if it's not quickly recognized and managed. Thus, it's essential for both healthcare providers and patients to be vigilant about the potential risks when prescribing or consuming amoxicillin combined with clavulanate. Medical professionals ought to keep an eye out for any liver damage indicators, particularly for those under long-term treatment or on high doses of this medication. Individuals should promptly consult a healthcare provider if they notice symptoms like skin or eye yellowing, dark-colored urine, severe tiredness, nausea, vomiting, or abdominal discomfort, as these may suggest liver distress. The eighth drug, amiodarone, marketed under the name Cordarone among others, is commonly used to manage irregular heartbeats. While it stands out for its effectiveness in controlling and even resolving arrhythmias, as seen in 24-hour Holter monitor tests, it's crucial to note that amiodarone carries a high risk of adverse effects, impacting the thyroid, lungs, skin, and indeed the liver. Due to its extensive side effects, its prescription is now more conservative, reserved for specific scenarios where the therapeutic advantages surpass the potential health hazards. Typically, ototoxicity doesn't lead to immediate liver injury. Rather, it might take several weeks to a few months before the adverse effects on the liver become apparent. The seventh drug known to potentially harm the liver is allopurinol. For those dealing with high uric acid concentrations or afflicted by gout, merely changing the diet often doesn't provide adequate control over the condition. Under these circumstances, allopurinol is frequently recommended. This drug is adept at decreasing the levels of uric acid in the bloodstream and averting episodes of gout. Nonetheless, it's critical to acknowledge that allopurinol might lead to negative impacts on the liver. Liver complications linked to allopurinol usage can develop swiftly, at times only days or weeks, following the initiation of therapy. Hence, it's essential for individuals beginning allopurinol therapy to undergo thorough monitoring for any liver distress indicators. Ongoing health checkups are vital to detect any issues early and to modify the regimen if needed. Furthermore, patients ought to report any new or unusual symptoms they encounter while on allopurinol to their healthcare provider. Despite these potential side effects, it's crucial to recognize that allopurinol continues to be an essential treatment choice for numerous individuals suffering from gout or elevated uric acid levels. The sixth drug posing risks to your liver includes anticonvulsants, notably phenytoin, marketed as Dilantine, and valproic acid, known as Depakine. Dilantine can start affecting the liver soon after treatment commences, while the impact of Depakine may be evident from the first to the sixth week following the start of therapy. Hence, frequent monitoring of liver enzymes is essential. Additionally, although less commonly, drugs like carbamazepine and lamotrigine can lead to liver damage. The fifth pharmaceutical, methotrexate, is frequently used to treat conditions such as rheumatoid and psoriatic arthritis, as well as certain cancers. However, it's critical to continuously check liver enzyme levels when on methotrexate due to the potential for liver harm, which can vary from mild to severe. In some instances, this could result in considerable liver injury if not promptly identified and addressed. Therefore, physicians typically conduct regular liver enzyme screenings for patients on methotrexate, enabling the early detection of liver issues and permitting necessary adjustments to the medication or overall treatment plan to prevent serious health issues. Moreover, adhering to medical recommendations for methotrexate's dosage and frequency is crucial to lowering the likelihood of adverse effects, including those affecting the liver. In certain situations, based on the patient's overall health and reaction to the medication, the physician might explore alternative treatments to lessen the chances of liver damage. The fourth class of drugs that pose a risk to liver health includes antifungal agents, notably fluconazole and itraconazole, which are effective against conditions like candidiasis and onychomycosis, but can lead to liver toxicity in some individuals. Hence, monitoring for liver toxicity symptoms is important when undergoing treatment for fungal infections with these drugs. The third pharmaceutical with potential liver impact is methyldopa, commonly used to manage hypertension and notably prescribed for pregnant women with high blood pressure. Although generally considered safe, methyldopa has been linked to liver damage, making it unsuitable for people with existing liver conditions like fibrosis or cirrhosis. Patients should be vigilant for liver-related side effects for up to 3 months after beginning methyl-dopa treatment and undergo regular monitoring to catch any liver issues early. This vigilance helps avoid exacerbating liver health while treating hypertension, and those with liver disease history should seek safer alternatives with their healthcare providers. The second category of drugs, antipsychotics like risperidone and olanzapine, sold as Zyprexa, are utilized not only for psychosis management, but also for treatment-resistant depression, meaning depression that hasn't improved with standard treatments. All medications carry the risk of causing liver damage, particularly through a mechanism known as drug-induced cholestasis. This condition results from the disruption or slowing down of bile flow from the liver, which is crucial for fat digestion and the removal of specific body wastes. Drugs such as risperidone and quetiapine can halt this bile movement, leading to its buildup in the liver and possible liver injury. Hence, individuals on these drugs need constant monitoring for any liver dysfunction indicators. The top drug linked to liver failure is paracetamol, widely recognized for its connection to drug-induced liver issues. Liver harm typically arises not from standard dosages, but from excessive consumption. Given its common use, some individuals might consume more than the suggested amount, significantly increasing the risk of liver failure. Note that while paracetamol in prescribed doses is generally safe and prescribed even for infants, surpassing these amounts can be hazardous. Over a third of drug-related liver failure incidents stem from paracetamol overdosing, leading to severe liver damage and, frequently, the need for a liver transplant. Unlike kidney issues where dialysis can offer temporary relief, severe liver damage might necessitate a transplant. Moreover, factors like alcohol use, genetic predispositions, and concurrent use of other harmful medications can elevate liver damage risks. Paracetamol-induced liver damage typically starts from 1 to 3 days post-ingestion, with symptoms manifesting after 2 to 4 days. Fortunately, there exists a remedy for paracetamol overdose, acetylcysteine or fluimucil, which, aside from being an expectorant, is utilized in treating certain mental health conditions. This antidote can safeguard the liver following an overdose, but exceeding recommended paracetamol levels necessitates immediate medical attention to avoid drastic measures like liver transplantation. It's crucial to recognize that the absence of a drug from this list does not imply it's safe for the liver. Many medications, including antiretrovirals, certain vitamins like niacin, other antibiotics, supplements, and even certain teas, can harm the liver. Given the liver's critical role in overall health, avoiding drug-induced hepatitis and the more severe fulminant hepatitis is vital. The latter affects a significant number of individuals with acute drug-induced liver issues and leads to jaundice. Only about 20% survive without undergoing liver transplantation. If you found this information helpful, please share it to spread awareness and subscribe for more updates. Thank you for watching.